Hi everyone, so tonight we'll be assessing my mom's abdomen and lower extremities. So to start with, I would have her lay in a supine position, arms by her side comfortably, and we'll inspect her abdomen for skin integrity, contour, and symmetry. So at this point, I would raise her blouse. I would just look at it. I would note that it is symmetrical and it is without any lesions or scars. And then the contour is normal. And then we would further by auscultating the abdomen for bowel sounds. We would do this in the systematic sequence, so starting at our right lower quadrant to our right upper, to our left upper, to our left lower. Okay, and I would document that it is normal active, and that all quadrants are active. Okay, and at this point, I would also perform the light palpitation in the different areas. Any tenderness? Okay, so no tenderness noted, no pain while palpating, and then we've already systematically explored all four quadrants, and then she doesn't have a history of urinary retention, so we wouldn't need to palpate above the pubis. So then moving on, we would go to the lower extremities. So we would assess the skin and nails. So the skin is pink, warm, moist, and dry, or pink, warm, and dry. Hair, it's shaved, so she doesn't have any hair noted. Nails are translucent, shiny, and firm to texture. And then we would assess for capillary refill. So at this point, I would have her take off her socks and we would do the capillary refill test. Normal would be less than 3-second refill, and then that would show us that she has good circulation. And then from here, we would palpate her popliteal, her post-tibial, and her dorsal pedis pulses. And we would do both of them at the same time to note symmetry and strength. Upon palpation, we would note that it is a 3, so normal pulse rate and strength. Then we would move on to the muscle strength test. So I would have her first push against my hands, and then push against them below, and then try and raise her legs with force, and then try to pull down with force. Okay. So did you have any pain? Okay, no pain noted. Everything seems fine there. And then we would move on to range of motion. So starting up at her hips, we would do supporting the knee, we would do flexion and extension, and then abduction and adduction, as well as rotation. We would do that for both sides, for both legs, and then we move down to the knee, so flexion, extension, and then we would move to the ankle. And here we have rotation, so have her rotate it. Okay. Some difficulty noted, and then eversion or inversion, and then eversion. And she does have difficulty with eversion. And then we would do plantar flexion, so have her go down, and then plantar or dorsal flexion upward. Okay, and like I said, you would do that to both extremities, and then note any difficulty upon range of motion exercises. So then we would move on to our light touch palpation. So I would have her close her eyes, Tell me where I touch.
On the left, right leg,
Okay.
upper leg. Down by my knee on the left. On my calf on my right.
Okay.
And on my bottom of my foot.
Okay. So no difficulty noted there. She was able to sense every touch. And then we would just have her stand up. So I'll have you stand up. Okay, stand up for me.
Okay.
And then start walking. Okay, so no lordosis, scoliosis, kyphosis noted. No uneasy gait. She's steady and upright. Okay, so that concludes our head to toe assessment. Thanks for watching.